lecture is basically about the clinical procedure of hand hygiene and hand care. So the infection control in the perioperative environment. But basically it's an introduction to SkinMan for both of you because you wouldn't have used it elsewhere. Obviously in the ward environment, which is what you're probably more used to, they don't have SkinMan and it's a different type of hand hygiene. So yeah, basically just an introduction to it. So starting off, this is the learning objectives that by the end of the 2 lessons that you're going to have with me, the training discussions, these are the objectives that we'd like you to achieve. So we'd like you to be able to define infection control in the perioperative environment, discuss the importance of hand hygiene in the perioperative environment, and demonstrate competence in SkinMan surgical hand hygiene. So just to start it off with a little bit of a quiz. True or false? Most germs can survive on your hand for 3 hours. What do you think? True? You're right. That's why hand hygiene is important. True or false? The average computer mouse is 3 times dirtier than a toilet seat.
I think so, because everyone touches it.
It's true, as I touch my mouse over here. True or false? Surgical site infections cost up to $8 billion per year.
True. Yeah, maybe true because of the infection.
It's actually false. It costs up to $10 billion per year.
Close
enough.
Yes. Close, but more than you think. True or false? 2 to 5% of patients undergoing surgical procedures suffer from surgical site infections.
It's high, isn't it?
Maybe more than that.
Yeah, maybe more than 5%.
More than 5? No, that is actually correct, 2 to 5%, which doesn't seem like a lot, but then if you think about the bigger picture, so from a study found in Victorian Healthcare Associated Infection Surveillance System, out of 183,625 procedures, there were 5,123 surgical site infections. So that's obviously a huge number. So basically we just want to know how we can stop this. So a bit of a background, surgical site infections are potential complications with any type of surgical procedure. Although they are still considered among the most preventable healthcare associated infections and still represent a significant burden in terms of patient morbidity and mortality, as well as additional costs to both health systems and healthcare payers worldwide due to prolonged hospital stay and hospital readmissions. Infection control and prevention in the perioperative setting assumes an even greater significance because of the vulnerability of patients who are already ill or injured. Surgery, anaesthesia and immediate post-operative recovery may expose them to invasive procedures, allowing more portals for entry of infection. There are many factors that affect the potential spread of infection, and as a result, there is ample evidence that shows the appropriate methods in place that are cheap, easy to apply and very effective in infection control. So factors that affect infection control in the perioperative environment. Can you think of any?
I think if we don't know how to proper, like starting from the scrub, we are not doing the hand proper scrub, so we got germs on our hand and we've just got donning and gloving is the most important thing, and the sterility of the instruments and the whole thing what we're using, the draping.
Yep, sure. Okay. Any ideas? Not yet.
No.
So these are a few that we could mention. So surgical attire, as you did say. So airborne bacteria in the operating room originate primarily from the skin and hair. So that's why we wear scrubs, hats, masks, eye protection and gown. Also bare below the elbows, no jewellery, no fake nails, no dressings. Another thing is patient preparation. So obviously we prepare the patient with chlorhexidine or betadine, and also then we only expose the skin. We've got sterile drapes all around. Surgical field preparation, we obviously have the surgical team who will perform a surgical scrub using antiseptic solution or an alcohol-based hand solution called SkinMan, which is what we're going to learn about today. We make sure that all instruments are sterile and accounted for, and that all members of the surgical team that are not scrubbed are standing at a distance from the sterile field. The environment, we've also learned about the air exchange, so we reduce the number of people and the movement of staff in and out of theatres. Obviously the air pressure, disposal of sharps, disposal of waste between cases, and cleaning schedules between cases and end of day. So what can we do to prevent the spread? So So we've got standard precautions that we can use. They are the work practices required to achieve a basic level of infection, prevention and control. The use of these precautions aim to minimise and, where possible, eliminate the risk of transmission of infection. So can you think of any standard precautions that we use in theatre that could help reduce surgical site infections?
Hand hygiene is important.
Big one, hand hygiene. Any others?
The same thing, sterility, if you don't think that
Sterility.
procedure.
Yep. These are the standard precautions. Hand hygiene, huge one, what we're going to learn about today. And there's a coronavirus around at the moment. Thing that they're saying that you can be protected from is not even masks, it's hand hygiene. That's what's the most protective for you. Personal protective equipment, so obviously your mask, your gowns, your hats, your boots, your mask and your apron. Safe and use of disposal of sharps, aseptic non-touch technique, reprocessing of reusable equipment, routine environmental cleaning, waste management and appropriate handling of linen. But obviously the one we're going to learn about today is the hand hygiene because it's most important. So hand hygiene in the perioperative environment, as I said, it's a lot different to what you learn on the wards because there's so many different types of hand washing. So you'll be used to routine hand washing with soap and water when dirty or visibly soiled. Also, alcohol-based hand rub when your hands are not visibly soiled is what you would be used to everyday life. However, in theatre we've got a few more. So we've got the aseptic hand wash. So wash hands with an antimicrobial soap and water for 60 seconds prior to performing an invasive procedure where a sterile field is required. For example, inserting an indwelling catheter. So that answers your question of the other day. This is what we're doing for a catheter, an aseptic hand wash. We can either use antimicrobial soap or we can use alcohol-based hand rub, which is Skin Man. So you can use this as an aseptic hand wash as well as a surgical hand wash. Use this prior to performing an invasive procedure such as a catheter where a sterile field is required by following the ABHR protocol for a minimum of 30 seconds. So for a catheter, it's an invasive procedure. It's aseptic though, it's not a surgical procedure. So ABHR for 30 seconds, whereas for a surgical hand wash, which you won't be required to do anytime soon, but it's good to know, surgical hand wash is what you're going to be learning today. So clinical staff undertaking surgical procedures using antimicrobial soap thoroughly wash hands, nails and forearms for 5 minutes and 3 minutes for subsequent scrubs of the day. So surgical hand wash is 5 minutes long. If you were doing it with ABHR, 90 seconds. So a little bit different to aseptic hand wash. Any questions?
No, good.
No? So Skin Man, what is it? A Skin Man 90 surgical hand rub is the alternative to the 5-minute standardised scrubbing procedure using antimicrobial soap. It contains 90% ethanol in a water clear solution and is an antiseptic hand rub for surgical hand disinfection. Differs from Aqueum because it's got a higher percentage of ethanol. Skin Man 90 meets TGA and European guidelines for use as both a pre-surgical hand rub and a hygienic hand rub. Skin Man provides rapid surgical hand disinfection in 90 seconds and a shorter time compared with traditional scrub provides numerous efficiencies to operating theatres. So obviously you can get it done faster. Rather than scrubbing for 5 minutes, you're doing it for 90 seconds. So you're able to be there faster. How do you use it? This is basically from the clinical guidelines of Women's and Children's Hospital. So surgical hand disinfection using ABHR. It's a quick one, but obviously you've got the guide that's in theatre that shows you all the actions that you have to do, which is a little bit easier to read. But basically, hands must be free from visible soil, thoroughly dry before commencing the hand rub, and then ensure all areas are covered in wet for 90 seconds and multiple applications may be necessary. ACORN also recommends that a minimum of 3 applications are used, if not more, when you are using Skin Man for 3 to 5 minutes. At completion of the rub, allow hands to air dry thoroughly before donning sterile gowns. So you're not going to tap your hands dry, you air dry your hands. Refer to the ACORN guidelines and the Skin Man 90 procedure chart for detailed protocols, so which is this one here. So this is what's up in theatre, the surgical rub technique. A little bit hard to read up there, but I'll read it out to you. So at the commencement of the theatre list, wash hands, forearms and nails using a non-medicated soap. So So at the start of the list, you still have to wash underneath your nails and use a non-medicated soap to scrub. So you can't just go straight into Skin Man. You have to wash your hands first for the first scrub of the day. Remove debris from underneath the nails using a nail cleaner under running water and scrubbing with a disposable sponge. So that's the sponges that are in the scrub sink. You just open it underneath your nails and then wash with normal soap. Hands must be thoroughly dry before commencing the surgical hand rub. So then following this, dispensing 1 pump of Skin Man 90 and distribute onto both hands. Then dispense 2 to 3 pumps of Skin Man onto the palm of the left hand. Dip fingers of right hand into Skin Man 90 to decontaminate nails. Apply Skin Man 90 to right hand and forearm up to elbow. Continue rubbing for 10 to 15. Dispense 2 to 3 pumps of Skin Man into pump of right hand. Do the same thing on the other side. So we're going to learn this later, especially you, because you've already seen a little bit of it. But we'll go in and do a demonstration in theatre and then a practice, and then we'll have a practice with you and then we'll do a little bit of a quiz. So in summary, surgical site infections are one of the most prevalent but potentially preventable healthcare associated infections. Factors that affect infection control include surgical attire, patient preparation, surgical field preparation, perioperative and environmental influences. There is a variety of hand hygiene that is an important factor in preventing the spread of infection. And we learned how to use Skin Man. So the next class for both of you will go off separately. Kevin, we're going to be learning to perform Skin Man. So I'll demonstrate it to you and then you can follow and practice. And Amy, we're going to do a bit of a Skin Man quiz so that you can practice and test your knowledge that you've already got.
Sure.
Are there any questions?
All good.
Clear?
Yeah.
Now I've got some feedback forms. If you would please fill them out, I can do that in a second. So thank you very much.
Thank you.
Thank you.